Hello everyone, Dr. Alex Carter here. Today we're going to talk about something incredibly important. The subtle and sometimes not so subtle signs your body gives you when it's crying out for specific nutrients. It's fascinating how our bodies communicate with us, but often we don't know the language. We might ignore a small symptom, thinking it's just a part of getting older or stress, when in reality, it's a clear signal of a nutritional deficiency. In this video, I'm going to break down 10 of these common signs, from skin issues to strange sensations in your feet, and explain exactly what your body is trying to tell you. You're going to learn how to become a detective for your own health. We'll go through each of these 10 signs in detail, connecting them to specific vitamin or mineral deficiencies. But I won't just leave you with the problem, the most important part is the solution. For each sign, I'll provide practical, actionable advice on how to address the deficiency. This includes specific dietary changes you can start making today, and recommendations for high-quality supplements that can help you replenish your nutrient levels effectively and get you back to feeling your best. By the end of this video, you'll be equipped with the knowledge to spot these deficiency signs, not only in yourself, but potentially in your loved ones as well. Understanding these connections is a powerful tool for taking control of your health. It's not about diagnosing a disease, but about listening to your body and giving it the raw materials it needs to function optimally. So, get ready to decode your body's signals and learn how to truly nourish yourself from the inside out. Let's get started. Let's start with number 1, skin tags. You might have seen these little growths of skin, often on the neck, under the arms, or in the groin area. Many people think they're just a cosmetic issue, something that happens as we age. But they are actually a very strong indicator of what's happening inside your body. Specifically, skin tags are very common in people who have high levels of insulin. This means if you have prediabetes or even full-blown type 2 diabetes, you are much more likely to develop them. They are essentially an external sign of insulin resistance, where your cells are no longer responding properly to the hormone insulin. So what can you do about this? The key is to address the root cause, which is the high level of insulin. You need to lower your insulin, and the most powerful way to do that is by significantly decreasing your carbohydrate intake. I'm talking about cutting out the sugars, the breads, the pastas, and the refined grains that spike your blood sugar and in turn, your insulin. At the same time, you want to increase your consumption of high-quality protein and healthy fats. This dietary shift helps to stabilize your blood sugar, reduce insulin levels, and can effectively help reverse the progression of insulin resistance and diabetes, often causing the skin tags to shrink or even disappear over time. Moving on to sign number 2, which can be a bit of an uncomfortable topic, but it's very important: itchy private parts. This could be in the groin area for men, or a vaginal yeast infection for women. This persistent itching is almost always caused by a fungal overgrowth, specifically Candida. Candida is a type of yeast that naturally lives in and on our bodies, but when our immune system is compromised or our internal environment is out of balance, it can grow out of control, leading to these uncomfortable symptoms. A diet high in sugar and carbohydrates is a major contributor, as sugar is the primary food source for yeast and fungus. To combat this, you need to strengthen your body's own defense system. One of the most critical nutrients for your immune system, especially for the white blood cells that fight off pathogens like Candida, is vitamin D. A significant portion of the population is deficient in vitamin D, especially those living in colder climates with less sun exposure. Supplementing with a high-quality vitamin D3 can be a game changer. It helps to modulate and strengthen your immune response, allowing your body to get the fungal overgrowth back under control and stop that frustrating itching. Sign number 3 is something that plagues many people: nighttime restlessness. This isn't just about having trouble falling asleep, it's that feeling of being wired but tired, where you lie down but your mind is racing, or you feel a strange, restless energy in your body that prevents you from settling into a deep sleep. You might toss and turn, or feel like you just can't get comfortable. This specific type of restlessness, especially at night, is a classic symptom of a vitamin B1 deficiency. Vitamin B1, also known as thiamine, is crucial for the proper functioning of your nervous system. So where does this deficiency come from? The number 1 cause of a vitamin B1 deficiency in our modern world is a high carbohydrate diet. When you consume a lot of sugar, refined grains, and other processed carbs, your body uses up its B1 stores to metabolize all those carbohydrates. It's a water-soluble vitamin, so you don't store it for long. If you're constantly eating high-carb meals, you're creating a chronic deficit. The solution is twofold. Reduce the carbs that are depleting your B1, and increase your intake of B1-rich foods, or consider taking a good B-complex supplement, preferably one derived from nutritional yeast, to replenish your levels and calm your nervous system. Alright, let's dive into sign number 4, a tingling pins and needles sensation or even numbness, particularly in the toes or the bottoms of the feet. This condition is known as peripheral neuropathy, and it's a clear sign of a nerve problem. You see, the nerves in your extremities, especially your feet, are becoming damaged. Now, while this is a very common complication of diabetes due to high blood sugar damaging the nerves over time, it can also occur in people without diabetes who have a specific nutrient deficiency. This sensation is basically your nerves sending out distress signals that they are not getting what they need to function correctly. The key nutrient to address this specific type of nerve issue is a special form of vitamin B1 called benfotiamine. Benfotiamine is a fat-soluble version of thiamine, which means it can penetrate the nerve cells much more effectively than the standard water-soluble form. It helps to protect the nerves from damage and can actually help them to repair and regenerate. For this to be effective, it's often recommended to take benfotiamine multiple times throughout the day, perhaps 4 times daily, to maintain a steady level in your system. This can provide the nerves with the continuous support they need to correct the problem and alleviate that tingling and numbness. Moving on to sign number 5, it's something you might notice when you brush or floss your teeth: bleeding gums. You might see a little pink in the sink and think you just brushed too hard. However, if it happens consistently, it's not normal. Healthy gums don't bleed. Bleeding gums are a classic textbook sign of a vitamin C deficiency. In its most severe form, a vitamin C deficiency leads to a condition called scurvy, and bleeding gums are one of its primary symptoms. Vitamin C is absolutely essential for building and maintaining collagen, which is the glue that holds your body's tissues together, including the delicate tissue of your gums. When you don't have enough vitamin C, your capillaries become weak and fragile, and they break easily, leading to bleeding. This applies not just to your gums, but you might also notice easy bruising elsewhere on your body. The solution here is straightforward: increase your vitamin C intake. While you can take a supplement, I always recommend getting it from whole food sources first. Things like bell peppers, especially red ones, leafy greens like kale, sauerkraut, and berries are excellent sources. If you do supplement, look for a whole food-based vitamin C complex, not just isolated ascorbic acid, as it will contain the cofactors that help your body utilize it best. And finally, sign number 6, carpal tunnel syndrome. This is characterized by pain, numbness, and tingling in the hand and arm, caused by a pinched nerve in the wrist. It's often associated with repetitive motions, like typing on a keyboard for hours a day. While mechanical stress is a factor, there's often an underlying nutritional component that makes you more susceptible to this inflammation and nerve compression. Many people who suffer from carpal tunnel syndrome are actually dealing with a vitamin B6 deficiency. Vitamin B6 is vital for nerve function and also acts as a natural diuretic, which can help reduce fluid retention and swelling that may be contributing to the compression of the nerve in the carpal tunnel. It plays a role in over 100 enzyme reactions in the body, many of which are related to nerve health and reducing inflammation. Before considering drastic measures like surgery, it's incredibly worthwhile to try supplementing with vitamin B6. Look for the active form P5P or pyridoxal 5-phosphate, as it's more easily utilized by the body. Addressing this deficiency can often provide significant relief from the pain and numbness of carpal tunnel syndrome. Let's move on to sign number 7, which you can see right at your fingertips: brittle nails. Are your nails weak? Do they split, crack, or peel easily? Do they just not seem to grow strong no matter what you do? This is a very common complaint, and it's usually a straightforward sign of a biotin deficiency. Biotin is another one of the B vitamins, also known as vitamin B7. It's famous for its role in supporting the health of our hair, skin, and nails. It does this by playing a key role in the production of keratin, which is the main structural protein that makes up our nails. When you're low on biotin, your body can't produce high-quality keratin, and the result is nails that are weak and brittle. This deficiency can be caused by a few things, including the consumption of raw egg whites, which contain a protein called Iodine that binds to biotin and prevents its absorption. Some gut issues can also interfere with your body's ability to produce and absorb biotin. The fix is often as simple as taking a biotin supplement. Supplementing can strengthen your nail plate, reduce splitting, and help you finally grow the strong, healthy nails you've been wanting. Sign number 8 is a feeling that many people, especially women, are all too familiar with: consistently cold feet and hands. Even when you're in a warm room or under a blanket, your extremities just feel like ice. This isn't just poor circulation in the way most people think about it. It's often a sign that your body's central thermostat, your thyroid gland, is not working optimally. The thyroid gland controls your metabolism and body temperature, and the most important nutrient for the production of thyroid hormones is iodine. When you're deficient in iodine, your thyroid can't produce enough T4 and T3, the hormones that regulate your metabolic rate. This condition is called hypothyroidism, and one of its hallmark symptoms is cold intolerance, particularly in the hands and feet. Our soil has become depleted of iodine, and many people avoid iodized salt, leading to widespread deficiencies. To address this, you need to get more iodine. Sea kelp is an excellent natural source, as are other sea vegetables and seafood. Taking a high-quality sea kelp supplement can provide the raw material your thyroid needs to ramp up hormone production, increase your metabolism, and finally warm up those cold hands and feet. Number 9 covers a cluster of problems that tend to strike in the very early morning, often between 2 and 3 a.m. Things like painful leg cramps, also known as Charlie horses, waking up with a migraine, or even experiencing chest pain or tightness. If you find yourself being jolted awake by these symptoms in the middle of the night, it's a huge red flag for a magnesium deficiency. Magnesium is the master relaxation mineral. It's involved in over 300 biochemical reactions in your body, and a primary role is to help your muscles and nerves relax. It counteracts the effects of calcium, which causes muscles to contract. When you're low on magnesium, you lose this balance. Your muscles can go into a state of hyperexcitability, leading to cramps and spasms. This includes the smooth muscle of your blood vessels, and spasms there can trigger migraines or chest pain, which is also called angina. Why does this happen in the early morning? It's often linked to cortisol rhythms, but the underlying issue is the lack of magnesium. The best way to combat this is to take a well-absorbed form of magnesium, like magnesium glycinate, before you go to bed. This helps to saturate your system with this crucial mineral overnight, promoting muscle relaxation, preventing cramps, and allowing for a peaceful, uninterrupted night's sleep. Finally, let's talk about sign number 10, which is a very serious one: chest pain, or pain that radiates down the left arm or into the shoulder. Now, of course, if you are experiencing this, you must get it checked out by a doctor immediately to rule out a heart attack. However, if a cardiac event has been ruled out and you still experience this kind of pain, especially with exertion, it can be related to a lack of oxygen getting to the heart muscle. This can often be linked to a deficiency in vitamin E, but a very specific part of the vitamin E complex. Most vitamin E supplements on the market are just one part of the complex, alpha-tocopherol. But the part of the vitamin E complex that is most beneficial for the heart and for oxygenating the tissues is the tocotrienols. Tocotrienols are a much more powerful form of vitamin E. They have incredible antioxidant properties and have been shown to help improve circulation and reduce the oxygen demand of the heart muscle, making it work more efficiently. If you're experiencing this type of angina-like pain and your heart is structurally okay, supplementing with tocotrienols, not just standard vitamin E, can be the best remedy to help resolve this issue by ensuring your heart muscle gets the oxygen and protection it needs. So there you have it, 10 powerful signs your body uses to tell you it's missing crucial nutrients. From skin tags pointing to insulin issues to nighttime leg cramps screaming for magnesium, our bodies are constantly communicating with us. The key is to learn the language. I hope this video has helped you decode some of these signals so you can take proactive steps to give your body what it truly needs. Remember, addressing these deficiencies early on is one of the most effective ways to prevent more serious health problems down the road. It's all about creating a body that is resilient and functions at its absolute best. Now, it's very important that I include this disclaimer. The content in this video is for educational purposes only and is based on my personal opinions and research. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen in this video. The information presented here has not been evaluated by the Food and Drug Administration. By watching this video, you agree to use this information at your own risk. Treasure of and its affiliates assume no liability for any losses or damages that may result from the use of the information contained in this video. Your health is your responsibility, and this knowledge is a tool to help you make more informed decisions in partnership with your healthcare provider. Thank you so much for watching, and I look forward to seeing you in the next video.